Hello and good morning, everybody. Welcome to this free taster session on what makes men healthy physically and mentally. We're a couple of minutes before we're due to start, so we'll get going in a couple of minutes' time. You'll notice that your cameras and microphones are deactivated. This is because today's session is going to be attended by many people, so we just want to avoid any distractions. And we'll get started on time very shortly. My colleague here, Shannon, is with me today as well. We're going to do an introduction very shortly as well, but we're just waiting for those numbers to creep up. As I say, we've got several hundred people registered for today's session, so we want to get those numbers high as possible before we do start to ensure as many people get here that want to. So get yourself comfortable. We'll go through how we're going to work this morning in a moment as well. So sit back and relax, and we'll get started very shortly. Thank you. Okay, so it's turned 10 o'clock. Numbers have reached over 100. So we'll make a start, and hopefully if anybody else is joining, they'll be welcome to stay. So over to you, Shannon. Thank you.
Thank you very much, Adam. First and foremost, thank you very much for joining, everyone. Happy Thursday. Hope we're all having a stellar week so far. As Adam said, what we're going to do, we're going to start with a little bit of an introduction, and we are going to discuss exactly what this taster workshop today is going to touch on. Now, obviously, you do have your cameras and microphones turned off, but if anyone does have any questions at all, we do have the Q&A function, and it is likely, because we're going to want to be giving you as much information as possible within the time, that we'll leave any answers to the end. So if you do pop a question in, please don't worry, we are not ignoring it, but it's just to make sure that we can get through all this information and then potentially be able to answer that question for you a little bit later on. So today's topic of the webinar is talking through what makes men healthy physically and mentally. And we've got a little bit of information here regarding the taster session overall. So just have a bit of read of this slide for me. This session is essentially, as you can see here, a free high-level taster session of the potential training and workshops that we as PAM Wellness deliver. So it is the case that we cover a range of workshops, and we do have a selection to potentially suggest for you or show you towards the end. As I mentioned, if you have any questions, please use the Q&A chat throughout the webinar and we will answer them at the end. And if you do have any comments or suggestions throughout, the chat box is there. So absolutely go ahead and use that. So we've got roughly 260 people, which is a fab turnout. Thank you all very, very much for coming to spend your time with us. And I hope you enjoy it. So let's get started. So starting off with part one here, it is the case that we are going to go into men's health. So we're going to start off with what men's health is overall. We're going to look at it in a bit more of a holistic way. We're then going to delve deeper into physical health, touching more specifically on two things that affect men, which is heart disease and cancer. And then what we're going to do is spend a little bit of time talking about some healthy body lifestyle changes to reduce the risk of developing certain conditions. So just starting off, as I said, it is going to be the case that we touch on men's health holistically. Now, men's health is multifaceted, and these things on the screen, physical, mental, and spiritual health, they are all interlinked. They all work inclusively, not exclusively of each other. And without one, it might be the case that the others tumble. Now, with physical health, this is, basically what it says on the tin. It's the ability to maintain a quality of life. And that quality of life will allow us to get the most out of our daily activities. And not only that, but it's being physically able to do things whilst being pain or disease free, that kind of thing. So it's just more in general being physically well. We've then got mental health. Now, obviously, we're all aware of mental health, but it's that state of well-being that enables people to cope with the stresses of life. It's not necessarily illness related, it's not due to any mental disorders, that kind of thing, but it's essentially being able to cope with daily routines, daily lives, and the thing that life throws at us. And finally, we've got spiritual health. Now, this isn't something that is spoken about as often as the first two, but essentially spiritual health in a tin is about having purpose in the tasks that we do. It's about being able to make the tasks that we do purposeful to you. And it's essentially about knowing your why, knowing who you are, your direction, your true self. Now, that might sound like a huge question for a Thursday morning, and I can understand that it can be quite stressful to think, goodness me, who am I? Where am I going in life? That kind of thing. But as I said, if we break it down into smaller things, it's about giving your day-to-day direction and purpose and making sure that you're not just doing things for sake. So men's health in general is not just about pains and problems you feel on the body. It's essentially how content you are with yourself, with your life, with your future, and how control and connected you feel to that future. Now, what we're going to do, my section, because I am a qualified physiologist, I'm going to talk you through the physical side of things. And we're going to start off by having a closer look at one of the health conditions that does affect men a lot more than it affects women, and that is heart disease. Now, as you can see by that top bullet point, cardiovascular disease refers to all diseases of the heart and circulation. So that would be coronary heart disease, atrial fibrillation, heart attack, stroke, and congenital heart disease. And it's actually the leading cause of death of men aged 50 to 79 years old. Now, as you can see, the primary cause of cardiovascular disease or heart disease is called atherosclerosis. Now, atherosclerosis is essentially a buildup of fatty plaques, fatty material on the walls of our arteries. Now, these plaques are made up of things like fat, they're made up of things like cholesterol, calcium. And essentially over time, what will happen is these plaques on the walls will start to harden. This means that the arteries will narrow. This means that our blood flow will be restricted. And this could lead to further complications. So things like heart attack, stroke, that kind of thing. Now, it is the case, as you can see by that bottom bullet point, 90% of heart disease is preventable. Don't get me wrong, we have the uncontrollable factors, so things like age, gender, ethnicity, family history, that kind of thing. That does all play an effect. But the thing is, atherosclerosis, so that plaque building up on the artery walls, will happen regardless. So as we get older, the chance increases, the rate that it happens also increases. But the question is, and this is going to sound a bit deep for a Thursday morning, will you die from it or will you die with it? And the answer to that question is affected by the controllable aspects. So essentially our lifestyle and how well we look after ourselves. So when it comes to knowing if you are at risk, as I said, age increases that chance anyway. So it is the case that quite often we are all at risk at any given time and we're not aware of it. It is known as the silent killer. But you can see at the bottom of this slide here that there are two ways to increase the chance of knowing if you are suffering from atherosclerosis. The first is waist to height ratio. So it is the case that your waist should be half your height or less. For example, if you are someone who is 5'10", that is roughly about 70 inches, your waist should ideally be around 35 inches or less. And it is the case that we do tend to find, and this is just a generic thing, but men do tend to wear their jeans not necessarily on their waist. They tend to wear them on their hips. So it might be the case that if you're looking at your jean size and you think, oh, 34 inches, that's absolutely fine. Take a note of where you're wearing them. Your waist is considered 2-finger kind of spaces below your belly button. So if your hips are a bit thinner, but your waist is a bit bigger, that's something to look at. And if your waist is greater than half your height, take action as soon as possible. Another way to tell is by looking at our visceral fat content. Now, as you can see on this right-hand side over here, visceral fat essentially sits on or around our organs. So you can see it just in this diagram up here. It's this little section here. Now, it is the case that, what happens is it increases pressure. It reduces efficiency. It puts extra stress on those organs that are already trying so hard to keep us alive, keep us healthy. Now, you might feel okay. You might feel fine and dandy. You might not have any idea that anything's wrong. But the idea is that these organs don't feel okay. They are stressed. Sounds a bit strange to say an organ's stressed, but they're stressed. They've got pressure being put on them. And increased visceral fat increases our blood pressure. It increases our cholesterol. It increases our risk of type 2 diabetes, and it increases our risk of cancer as well. Now, it is the case that cardiovascular disease or heart disease isn't an overnight thing. It does creep up, and it does creep up without warning. So if you're someone who's potentially sat there thinking, oh, maybe I could go away and do something about this, absolutely. It's only going to help, not hinder. And at the end of the day, doing something, anything at all, is better than nothing. Okay, so now we've discussed cardiovascular disease, it is the case that we are going to take a closer look into cancer. Now, when it comes to cancer, causes of cancer can be placed into 2 camps, things we can control and the things that we can't. So it's similar to the previous slide. The things that we can't control are genes, our age. We can't stop aging, and the risk does increase with aging that we can't control. But what we can control, once again, are our lifestyle choices. So as you can see on this left-hand side, 38% of cancer cases are actually preventable. The most common cause of cancer is smoking. That will obviously lead to lung cancer. And the second most common cause of cancer is being overweight or obese. Now, it is the case that smoking is a lifestyle behavior we can actually have control over. Being overweight and obese, we know it's a little bit more complex, but for the most part, it is the case that we do have control over that as well. And as you can see on the right-hand side, there are 13 types of cancer that are attributed specifically to being overweight and obese. So it is the case if I read through them here. So we've got brain cancer, thyroid cancer, esophagus cancer, breast, liver, stomach, kidney, gallbladder, pancreas, bowel, ovary, and cervical cancer as well. Now, more than 90% of new weight-related cancers occur in men and women over the age of 50. And that's a bit of common sense. As we know, age increases our risk. And if you add to that the idea of being overweight and obese also increasing that risk, you are putting yourself in a little bit of trouble there. So it's very, very important that we need to make sure we are looking after ourselves as much as possible. Now, that being said, being overweight or being obese or smoking does not mean that you will automatically get cancer, but it does mean that you are more likely to reduce your risk if you keep a healthy weight and, as much as you possibly can, look after yourself. That is the ideal. And there are 2 types of cancer that aren't on this screen right now, but we are going to touch on them because they are definitely a lot more common when it comes to men, and we need to discuss them. So the first one is prostate cancer. Now, prostate cancer is actually the second leading cause of death over the age of 50, and the prevalence of it has risen since the 70s. So 1 in 8 men in the UK will get prostate cancer in their lives. And once again, that risk increases over the age of 50. And your risk is also increased if you have a family history due to genetics. So if you are a black man, that risk is increased as well. And once again, just touching on that previous slide, if you're overweight and obese, sorry. So just delving a little bit deeper into this topic. Now, the prostate is a gland. So it's a gland that's usually the shape and size of a walnut, and it grows bigger as you get older. It sits underneath the bladder. It surrounds the urethra, which is the tube that carries urine out of the body. And essentially, prostate cancer develops when cells in the prostate, so that walnut-shaped gland, starts to grow in an uncontrolled way. Now, some prostate cancer grows slowly. It can, you can live with it forever. It might not even affect how long you live. You might not need treatment. You might just need checkups to make sure that nothing abnormal is happening. But some prostate cancer goes quickly. It can be more likely to spread, it's more likely to cause problems, and it needs treatment to stop it spreading. Now, the thing is, most men with early prostate cancer don't have any signs or symptoms, and it is the case that it can be quite difficult to test for. But a couple of changes to look out for. And it is the case that if you have any of these warning signs at all, please go and get it tested. Just go and get it looked at. It's better to be safe than sorry at the end of the day. So as you can see, certain signs and symptoms: needing to urinate more often than usual, including at night; difficulty starting to urinate; straining or taking a long time to finish urinating; having a weak flow; feeling that you're not emptying your bladder fully when you do go to the toilet; needing to rush to the toilet; dribbling urine after you finish; pain when urinating, ejaculating, or finding blood in your urine or semen. So it is the case that if any of those things are happening, you might pass them off as being age related. You might pass them off as something else and say, oh, I'm just getting old, that kind of thing. Don't mask them. Get it checked. It could be nothing, but at least you'll know. And if you were to go to the doctor or the GP, it would be a case that the certain tests would be a urine test, a blood test, and a digital rectal examination. Okay, moving on now to testicular cancer. So testicular cancer is a rarer type of cancer when compared to the others that we've discussed, and it only accounts for 1% of all cancers that occur in men. So that's roughly around 2,200 that are diagnosed each year in the UK. Now, the symptoms of testicular cancer, one of the most common symptoms, as you can see here, is a painless lump or swelling in one of the testicles. So it might be the size of a pea or much larger. It might be the case that you also experience a dull ache in the scrotum area or feeling of heaviness in the scrotum as well. Now, it is the case that there are other explanations for these symptoms. So if you are looking at this list and thinking, oh, goodness me, that sounds like something I'm experiencing, don't automatically jump to testicular cancer, similar to the previous slide, but it is always best to go and get it checked. It might be the case that you're developing a harmless cyst on the testicle, but either way, it would be helpful to either get it removed or get it confirmed that it's not going to lead to anything else. And it is the case that, thankfully, testicular cancer is one of the most treatable types of cancer. Early intervention is very important. So again, be aware of yourself, get to know yourself, lumps, bumps, what's normal for you, what isn't. And it is the case that treatment almost always includes the surgical removal of the affected testicle. So again, make sure we're checking ourselves, make sure we're looking after ourselves, getting to know our bodies as much as we possibly can. And please, please, please do not just pass it off as something else or getting old or, don't mask it, get it checked. Okay, so I've been through a bit of doom and gloom there. I do apologise, but it is the case that it's very important to make sure we are aware of this because, it might be the case that you didn't know any signs or symptoms of prostate cancer, and we need to make sure that we keep ourselves reminded. And what we're going to do now is we are going to touch on a few things to go through with you before I pass over to Adam for the second part of the workshop. Now, when it comes to physical health, it is the case, and I will say this straight out the gate, if you look after yourself via sleep, via exercise, via, a healthy, balanced diet, it's not to say that you won't develop certain conditions. Sometimes life does throw you a curveball. We're not saying if you eat 5 fruit and veg a day that you're going to be healthy and you're going to live to 100. But what it's going to do is it's going to put you in a better position to be at a lower risk of developing certain conditions and be able to live happy and healthily until old age. So the key 3 things, and I know everyone's probably sick of being told to do exercise and eat healthily, but we do it for a reason because it is so important and because it works. Now, when it comes to sleep, we need to make sure that we are touching on 3 things and prioritizing it as much as possible. Making sure the duration we have is between 7 to 9 hours. On average, you might be able to function on less, you might be able to function on more. But again, it's about knowing yourself. Making sure we're able to have good deep sleep and making sure that we work on our consistency. So waking up, sleeping roughly the same time each day. When it comes to physical activity, as you can see by this second bullet point here, the government guidelines are 150 minutes of moderate intensity activity per week. Now, if we split that up over 7 days, as you can see here, that is 21 minutes. We can all find 21 minutes somewhere in the day. We're not saying you have to go to the gym 7 times a week. We're not saying you have to run a marathon every single week. But the idea is what we want you to do is incorporate some form of movement, walking, swimming, going to the gym, play football, join a dance class, absolutely anything that you want to do. Make sure you enjoy it. And just remember, you're putting effort and energy into your future self. And that's what we want. And finally, when it comes to our diet, yes, eating fruit and vegetables is essentially what we want to encourage you to do, but it's not just that. When it comes to making sure that we have whole foods, nutritious foods, making sure that if we do treat ourselves, as you can see, it's not every other day, making sure that we enjoy food. Food keeps us alive. It's something that should be celebrated. It keeps us moving, mobile, and it allows us to do the things that we enjoy. So making sure that we fill ourselves with things that make us feel good and things that are good in nutrition. Okay, right, so that is the physical section over and done with. What I'm going to do now is pass over to Adam to talk through the psychological aspect of mental health.
Thanks very much.
Sorry.
That's all right, no problem at all, Sharon. I thought it'd be helpful actually just to address some of the questions that have come in for you there, because they may just get lost at the end. A couple of people asking about visceral fat content. How can that be measured, and how can they reduce visceral fat content?
Yeah, absolutely. So visceral fat, essentially the only way to measure it is by using something called bioelectrical impedance. Now, what this means is it's essentially, I'm sure you've all seen them. You might have the scales at the gym, or you might have a set of scales like this yourself. And it's the scales with the metal plates on the bottom. They might have a handheld section as well. And essentially what it does is it sends small electrical currents through your body. And these electrical currents bounce back based on the different substances that your body is made of. So it is the case that you can, I don't know, get them from Amazon. Depending on how much they are, some might be a little bit more accurate than others. But essentially what it allows you to do is figure out how much muscle mass you've got, how much visceral fat you've got, how much water content is in your body, that kind of thing. So it might be the case if you go to a gym, you could look for one there. Alternatively, you could order one online. And the way to reduce it, you're going to hate the answer, exercising, eating healthy, just making sure that we're not having too many processed things, making sure that we reduce the amount of bad fats and bad cholesterol that we're taking into our body. And it might be the case, say, for example, you're someone who is fit and healthy, the likelihood is you are going to have low visceral fat. If you're someone who's a little bit overweight, you are likely to have a little bit more visceral fat. The two, subcutaneous and visceral fat, do tend to tie together. So if it's the case that you want to reduce that number, exercise and healthy eating are the methods to do it.
And in terms of alcohol, somebody's mentioned in the chat there, where does that come into this?
So alcohol, obviously, in general, we all love a drink. It's not the best for you. It's not the best thing that we can put into our body. when it comes to alcohol, especially certain things like wine or beer, the high sugar content is going to add to that visceral fat. So it's the same with other processed foods, other processed drinks, that kind of thing. Ideally, making sure we're keeping under that guidance amount of 14 units per week. At the end of the day, if you want a treat on the weekend, absolutely go for it. But if you're serious about reducing that visceral fat, alcohol would be a good place to start.
Excellent. And just one final one for you there. Someone's asking, is the current crop of green veg powders drink seen as a viable alternative to fresh vegetables?
So it is the case when it comes to any type of vitamin, we would recommend food first. And that's just because it is the most raw, the most natural form of that vitamin. Don't get me wrong, it's not to say that these green powdered type things aren't helpful. It's not to say that they don't work for people, but you are going to get more out of the whole vegetable, and that's going to be the most natural source for you. These green powders and other types of vitamins, I know some people have, like the gummies and things like that. There's other things in there, when it comes to additives, sweeteners, obviously to make it taste nice. So if it's working for you, continue to do it, but we would recommend food first just because that's the best way.
Fantastic. Thanks very much, Shannon.
No
And
worries.
again, just to remind everybody that we will be going through the Q&A as well at the end of today's session to try and pick up any ones that we've missed. So please do keep your questions coming and we'll do our very best to answer as many as them. But again, thanks very much, Shannon. Really informative. I picked up loads myself there as well. Thank you. So for this second part of today's session, we're going to look at some key information related to men's mental health. We're going to look at some potential barriers that stop men from reaching out for much needed support. And we're going to look at some strategies that can support men and how men can help themselves. Now, when it comes to statistics around mental health, the last national study of health and wellbeing, also known as the Adult Psychiatric Morbidity Study, showed that 1 woman in 5 has a common mental health disorder, such as anxiety, depression, phobia, obsessive compulsive disorder, and panic disorder. This compared with only 1 in 8 men. Now, trying to fully ascertain a very clear picture of mental health statistics in the UK is extremely challenging, and there are many factors to this. Research into mental health statistics can only tell us what has been reported, and therefore there are likely to be many cases that go undiagnosed. And this may be especially true when we look at men's mental health. Whilst women are more likely to be diagnosed with a common mental health disorder, many mental health charities, such as the Men's Mental Health Foundation and the Men's Health Forum, argue that other indicators might give us a better understanding of the true pictures of men's mental health rather than just the number of clinical diagnoses. So let's have a look at other statistics that might give us a better picture. Over 3/4 of suicides in the UK are men. Men report significantly lower life satisfaction than women in the government's National Wellbeing Survey, with those aged 45 to 59 reporting the lowest levels of life satisfaction. 73% of adults who go missing are male, and 87% of rough sleepers are men. Men are nearly 3 times more likely than women to become alcohol dependent. 8.7% of men are alcohol dependent compared to 3.3% of women. And men are 3 times more likely to report frequent drug use than women, 4.2 and 1.4% respectively, with more than 2/3 of drug-related deaths occurring in men. 95% of the prison population in the UK are male, with 72% of male prisoners suffering from 2 or more mental health disorders. And men are also nearly 50% more likely than women to be detained and treated compulsory as psychiatric inpatients. Men have measurably lower access to social support, friends, relatives, and community. And men commit 86% of violent crime and are twice as likely to be victims of violent crime. And these figures can be shocking and demonstrate how there's a very real need to make sure as many men as possible are able to access the support they need as early as possible, so that fewer males are just remembered as another shocking statistic. Now, it's clear to see from the last slide that men are significantly less likely to reach out for support for their mental health than women. And the effects of this are not just only damaging for men, but for everyone in society. Men are more likely to use potentially harmful coping methods, such as drugs or alcohol or other escapist behaviours, such as throwing themselves into their work, and are less likely to talk to family, friends, or professionals about their mental health. In fact, only 36% of referrals to the NHS improving access to psychological therapies are for men. And this also collaborates with recent studies that we found at PAM when it comes to our EAP. Again, only around 35% of referrals are for men. Now, there are many reasons why lots of men find it difficult to reach out for support, and these on the slide are just a few that we've selected, and this is by no means an exhaustible list. As I'm sure you're all aware, there will be many others. So let's have a look at a few of these, and starting off with damaging stereotypes. A simple online search into the reasons why so many men don't reach out for support shows that centuries of cultural pressures of how men should behave, also known as toxic masculinity, is dominant. Toxic masculinity is a term often used to describe the negative aspects of those exaggerated masculinity traits. Some of these, such as stoicism, the endurance of physical and or psychological pain without the display of feelings and without complaint, can often lead to many men not reaching out for much needed emotional support. And men who can't speak openly about their emotions may be less able to recognize symptoms of mental health problems in themselves, such as anxiety and depression, and therefore are less likely to reach out for support themselves before reaching crisis point. And even if men do reach out for support, their symptoms are most likely to be underdiagnosed. Or the research shows that men who do seek support are less likely to only partially disclose their symptoms rather than a full disclosure. Many because they don't want to burden their GP, or others are just simply too embarrassed to do so. Therefore, if their GP, their doctor, doesn't fully recognise their symptoms of emotional distress, many men will fail to get the much help they need. And also, research carried out by PAM's Health at Work report showed that 47% of men find it difficult to access their doctor or GP, while 56% have personally been affected by delays accessing NHS support. Now, one reason given as to why so many men find it more difficult to access support may be due to the type of work that they do. So, for example, if there's less flexibility in the working day, then they may have to use annual leave or unpaid leave to attend medical appointments. And with 40% of men reporting that their ability to manage finances is one of the top two wellbeing issues that they worry about, then it's easy to see that this may be another potential barrier to accessing support. And the same PAM report also unearthed a discovery that male employees are twice as likely as their female employees to feel like their employer doesn't support their emotional well-being. According to the research, 16% of men said they had little or no well-being support from work, compared to just 8% of women. Again, this may be due to stereotypes, with men sometimes seem less likely or in need of emotional support at work. And further research from the Men's Health Forum suggests that 38% of employed men would be concerned that their employer would think badly of them if they took time off work for a mental health concern, compared to just 26% for a physical injury. And as we've already identified, many men are likely to engage in escapist behaviours that are damaging to themselves, such as excessive drinking or overworking, rather than talk about their feelings. Now, some mental health professionals state there are three ways of being in the world. One is thinking, one is feeling, and one is behaving. And they argue that rather than saying to men that they need to learn to express their feelings and for men to change the way that they've been so long conditioned to be, They suggest that psychological services need to be more male friendly. And advocates suggest that men will be more comfortable engaging in services that support their mental well-being through the use of their behaviours and thoughts. And as such, working with an initial emphasis on goals, tasks, and active problem solving. They assert that this style of therapy is much more better for men's habitual ways of working in the world. Now, as we mentioned earlier, that there are many men that feel that their employer doesn't support their emotional well-being, yet there are many ways in which an employer can provide mental health support to men. And this can include consistently communicating your values as an inclusive organisation, so men and all colleagues feel comfortable to reach out for much needed emotional support. And it's also important to create a psychological safe space to discuss men's mental health by maybe setting up a men's forum. And it's also a good idea to empower male line managers to be champions of mental health. This will help to create openness and hopefully overcome stigma. Also, try and work with your relevant networks, your EAP, your occupational health, or internal communication channels to signpost to resources and support for men's mental health. Some of those we're going to come on to very shortly. And it's also important to set the culture from the top. Maybe set up an event where senior leaders can role model the importance of men's mental health. This could be through sharing their own personal experiences of men's mental health issues or highlighting how they practice allyship to support colleagues. Here, we've also looked at how we can support one another's well-beings as colleagues. And the first is to look out for your colleagues and take a proactive approach. Let's face it, we're often with our colleagues a significant amount of time in the week, so it can be helpful to check in at regular intervals with them, see how they are, and offer an opportunity for dialogue to occur. Knowing and actively engaging with your colleagues can alert you to changes in things like mood, behaviour, work performance, or you might just notice someone not being themselves. All of this can indicate that a colleague may require support. Checking in and speaking to a manager, where appropriate, about your concerns could also help issues from compounding. And always ask twice and remember the backronym FINE. Feeling insecure, need encouragement. Quite often, it can be easy for men to dismiss a check-in from a colleague and placate them by simply replying, I'm fine, when asked how they are. Lots of us tend to use the word fine to hide how we're truly feeling. But by repeating, okay, how are you really? What is fine? What is not fine? Instead of closing off the conversation when the word fine is uttered, creates another opportunity for dialogue to occur and reiterates that you care. So the next time somebody retorts with the word fine when you ask how they are, try to remember that backronym. Feeling insecure, need encouragement. Ask twice. And try and encourage open and positive discussions of mental health. One-to-one conversations sometimes can feel intimidating and unnatural to some people. So if you're trying to support someone with their mental health, you could try invite them for a coffee, maybe a walk, or do another activity. This might create a distraction and maybe a more relaxing environment for people to share their feelings with you. And you might also want to let the person know that you're there to listen and to support them without judgment. And do reassure them that help is available. There's a range of support available to support men and everyone with their mental health. You could encourage them to contact their GP, their EAP, or highlight charities that offer mental health support for men so they know that they're not alone. And again, some specific examples of signposting are coming up very soon. And lastly, but not least, most importantly, what can men do to help themselves? Well, firstly, it's important to put less pressure on yourself to conform to what society deems as manly. And also be conscious of the times when you're acting up to those stereotypes to see if you can change it. Conforming to those societal pressures, like having to be self-reliant or stoic, is linked to poor mental health and also increased distress. And try and develop your own self-awareness. Look out for signs that you might be struggling with your mental health. This could include physical symptoms like changes in your appetite, energy levels, maybe some new aches and pains, digestive issues, trouble sleeping or sleeping much more than usual. Other signs could include being quick to feel angry or annoyed, trouble concentrating, persistent feelings of worry, or engagement in risk behaviour such as substance impaired driving, drinking alcohol more than usual, using recreational drugs, or thoughts of suicide. Now, if you do have those thoughts, or if any of those things are impacting on you, please do reach out for support from your GP or other organisations like the Samaritans. And it's also important to focus on those small, achievable steps. It can be quite easy to get overwhelmed by daily life when you're battling with your mental health. But by taking small, positive steps each day, you'll start to notice that your energy and outlook will gradually start to improve. And this can include simple things like making sure that you've eaten your breakfast, taking your breaks at work, and remind yourself of what you've achieved that day despite any difficulties that you might have had to overcome. And do seek support. Hopefully, you can take some comfort from attending today's session, knowing that you're not alone and that many men struggle with their mental health. Yes, it can feel daunting at first to reach out for support. It may take you a few attempts to do it. However, there are people out there that want to help you. And support can come in many forms, such as work colleagues, family, friends, or professionals. Now, on these next two slides, we've listed a number of support and information agencies that are available to support. CALM, the Campaign Against Living Miserably, takes a stand against suicide. The organisation is particularly inclusive of men's mental health as it recognises that over 75% of suicides are for men. The helpline and live chat are open from 5 p.m. to midnight every day, 365 days a year. Mind, this mental health charity provides an information and signposting service. The info line is open 10 a.m. to 6 p.m. Monday to Friday, except bank holidays. And they also have a really great website, lots of useful information, including crisis coping tools, local drop-in services, and much more. So again, if you want any further reading at today's session, really recommend that website. Hub of Hope, this is a really useful database of support services that allows you to enter your UK postcode and find the most useful mental health support in your area. So you just go to that website, put in your postcode, and it will list all the mental health support services in your local area. And there are more groups that are available. Male Voiced is a charity focused on supporting men with eating disorders. We mentioned the Samaritans as well earlier. This is a charity that provides a helpline that can be contacted around the clock. That number 116123 is that. There's no 0800, no area dialing code. It's just those 6 digits. They provide listening and judgment-free support for everyone, particularly those who are struggling with suicidal thoughts. And there are other groups as well, local groups focused on supporting men, which are becoming more increasingly popular. Some are specific to mental health challenges, like Andy's Man Club. They're a men's suicide prevention charity offering free to attend peer-to-peer support groups across the UK and online. So if there isn't one in your local area at the moment, and they are growing exponentially at the moment, then you can also join online. And other groups create opportunities for friendship and conversations like Men's Sheds. They're community spaces for men to connect, converse and create. The activities are often similar to those of garden sheds, but for groups of men to enjoy together with the aim to help to reduce loneliness and isolation, but more importantly, to be fun. Okay, so just to finish off Shannon's and I's presentations this morning, we just want you to remember that men's health is multifaceted. There's many things that impact on men's health, both physically and mentally. Statistically, men are significantly less likely to reach out for support for their mental and physical health. But what I hope you do take away from today is that support is available for everyone. Again, it may take time, it may take a few steps, but you are encouraged to do that. Now, as well as today's session around men's physical and mental health, there are a number of training workshops that we offer at PAM. These include things like men's mental health, smoking cessation, heart health, mental well-being and stress management, and many others. So if you are looking to provide your organisation and your staff with mental health support, please do get in contact with us. You can contact us on the following details, which is business support at pamwellbeing.co.uk, and our phone number 01925 976